Hi, I'm Dr. Ramzi Hassouneh, and I work at TriStar Southern Hills Medical Center, practicing with gastroenterology specialists of Middle Tennessee. I grew up in Ottawa, Ontario, in Canada. I was inspired to become a physician from a young age by experiencing a close family member who had a chronic illness. Seeing physicians interact with her with compassion, respect, and building that trusting bond really connected with me. I was inspired by them and decided to pursue medicine as a result of that experience. I've always been fascinated about the interaction of the digestive system and overall health. As we learn more about the human body, we've come to understand that gut health is integral in metabolism, immunity, as well as chronic illness. Gastroenterology as a specialty offers a really nice balance of having longitudinal patient care interactions in the office setting, as well as the hospital, as well as hands-on procedures. Hands-on procedures are very rewarding in that you can diagnose and treat someone in the same setting. So overall, gastroenterology combines critical thinking, preventative care, as well as hands-on procedures. One patient interaction that really confirmed that gastroenterology was for me was during my fellowship training. My team and I were consulted on a critically ill patient who is suffering from a gastrointestinal bleed. This patient was in an intensive care unit on life support and required an urgent endoscopy. We were able to find the source of bleeding and treat it. It was incredibly rewarding to see the patient go from critical illness to stabilization to subsequently going home a week later. It really reminded me and my team of the importance of what we do and the importance of timely intervention. My patient care philosophy is to treat every patient as I'd want a family member treated. That means listening carefully, explaining things clearly, and making sure they feel comfortable to ask me any questions they may want. Patients take time away from their busy schedules, often traveling significant distances to come and see me. I want to make sure that they feel their time with me has been valuable and they achieved some greater clarity about their illness and a clear plan going forward. It's completely understandable to be anxious before undergoing a procedure or surgery. I start off by explaining to the patient what we're doing, why we're doing it, what to expect before, during, as well as after the procedure. I also reassure patients that the procedures we do are minimally invasive, effective, and safe. They have a team of highly specialized individuals, including anesthesia specialists, whose sole responsibility is making sure the patient's comfortable and safe throughout the whole procedure. Once the patient understands the process and knows that they're in experienced hands, the anxiety typically significantly decreases. While I enjoy general gastroenterology procedures, from diagnostic upper endoscopies as well as screening colonoscopies, I do have some interest in advanced procedures. One procedure I specialize in is removal of large precancerous polyps. This is a great option for patients who want to avoid surgery and want to maintain their colon native anatomy. I also specialize in minimally invasive endoscopic weight loss and anti-reflux procedures. These are great options for patients who are looking for other options other than traditional surgery or are not good candidates for those procedures. I hope patients leave feeling heard, respected, and confident in their care plan. Most importantly, I want them to feel that they have a physician who's invested in their well-being. I'm grateful to have joined TriStar Southern Hills Medical Center, and I look forward to serving your community.